Welcome to this course on global health communication. My name is Tilly Gurman, and I'm going to be your professor for this course. I'm really excited to see you here with me. And when they first introduced or offered me the opportunity to develop my course, which I typically teach in an in-person format, I was a little bit skeptical. And not because I don't love health communication and not because I don't love behavior change theories and communication theories, but more so because typically the student who takes my course is required to take my course. So there are students that are health communication students within the global health department. And so I kind of know more or less what to expect and also know that they're required to be there. So thinking about the fact that you're taking this course voluntarily makes me think, well, I need to make sure that I'm really selling the idea of health communication and really making you understand the advantages of using theory for developing interventions and evaluating interventions. As a result, my hope is that by the end of the course, you'll have participated in an engaging and interactive course that makes you think differently about human behavior, and that it's actually a very dynamic learning experience, and so that you have a better appreciation for health communication and how theory can actually help to inform the development of more effective programs. So a little bit about me. I finished my DRPH, so my doctorate in public health, in 2007 from the Bloomberg School of Public Health, and my training was in health communication. While I was doing my doctorate work, I also completed some coursework at the Annenberg School for Communication at the University of Pennsylvania. And initially, again, from when I was very small, I always thought I wanted to be a physician, and I never really thought of myself going into public health, but largely it's because I didn't really know that public health existed. When I was in college, I heard about public health the first time when I went to a talk that was being given by Audrey Hepburn. I actually loved Audrey Hepburn as a child because when I first saw her in My Fair Lady. So I went to hear this talk, not because I was interested in the work that she was doing at UNICEF, but because I was going to see Audrey Hepburn and sort of get to see in live Audrey Hepburn, who was My Fair Lady. So while I was there, I learned about public health, and as a result, I started getting really interested about the possibility of tackling health issues, not from a one-on-one basis, but more of a population level. And, after I finished my undergraduate degree and I started working in the field, I started getting really interested in not just, what sort of programs we can develop to improve the health of the population, but thinking about really the complexity of behavior, and that behavior change is not sort of a simple task, and that telling people the information they need to know about a particular topic, that's not necessarily going to get them to change what they do. I learned that firsthand when I was working in a family planning clinic, and in my conversations, I was working as a counselor, and in my conversations with women about the choices that they made about their reproductive health, I really realized that the knowledge about family planning or HIV, that knowledge alone was not enough to actually motivate their behavior. So that's when I really started getting interested in this idea of health communication. And over the years, I became interested in a variety of different topics around adolescent health, reproductive health, cultural competency, specifically around provider-patient communication, and thinking about ways to develop programs that could actually improve population health. So in terms of this particular course, as I mentioned before, human behavior is a very complex thing. And when we think about many of the problems that are facing the world on a health side, many of them come back to being preventable conditions. So we think about things such as obesity, smoking, a lot of these behaviors that down the line lead to some of the most difficult sort of conditions and illnesses such as cancer. they all sort of come back to something that's preventable in the human behavior. So if we can sort of start there, intervene there, and get people to change their behavior, then that can help prevent a lot of the burden that we have of disease on a global level. So, how you might ask yourself, how might I be successful in this course? And I would say, and this is what I often say to my other students, is that your participation is really key in this course. And yes, I'm here, you're there. We're not necessarily going to be talking to each other in a live format all the time, but we're still interacting with each other. And I hope to actually be able to learn from the students in the course. Hopefully you'll also be learning from me. And I want to sort of stress on the same lines that this is a graduate level course, and I do tend to have high expectations. I structured the course with high expectations, and my students have told me in the past that I do expect a lot of my students. In return, I expect that you probably have very high expectations from me. And so as I developed this course, I really wanted to make sure that every activity that you do during the live session and all of the activities that you do during the asynchronous sessions have a purpose to it. So I really encourage you to take advantage of every single activity that we offer you throughout the duration of the course. So with that, again, I just want to welcome you, and I look forward to the rest of the semester.